Hi, Marina. Delighted to have you on today. You
Hi,
definitely,
Gemma.
you definitely don't need an introduction within the Southern Trust. So we're delighted to see you online here today. I know who you are, and many within our trust and maternity know who you are. But for anyone who's listening online today, I would love you to tell us who you are and what you do and your role, and a wee bit about yourself. Is that all right, Marina?
Great. Great, Gemma. Lovely to be here too. So good to see you again. I am the head of the Education and Training Department in Aware NI. So Aware NI, as you can see behind me here, is the depression charity for Northern Ireland. I would lead on both the design and delivery of mental health education programs, and they run sort of right across Northern Ireland. And a big part of my role would include the perinatal mental health, as well as workplace and adult and young people's programs we deliver into the schools as well. But I've worked for Aware for the past 10 years and been very heavily involved in the what we call the Parent and Baby Project here, which is funded by the Public Health Agency in Northern Ireland. So I would work alongside the statutory bodies, other voluntary and community sector organisations, and we would just work together to help improve access to mental health services in Northern Ireland and provide information really for those people who need it within the perinatal field. So that would be, postnatal and antenatal, so expectant and new parents. And our aim would really to be to provide support for those expectant and new parents in Northern Ireland. And we do that, through a few different ways, which we're probably going to explore a wee bit.
Thank you so much, Marina. That is brilliant. So, why did you agree and your team to come on here today and talk to us on Maternal Mental Health Week awareness?
I suppose we've had a great relationship with the Southern Trust, yourself in particular, Gemma. You're very passionate about looking after those expectant and new parents. And I myself as well have been very passionate about parental mental health. It's just something that, the earlier I suppose that we can speak to people at different stages of their lives, then there's just a greater impact on them in the long term. So reaching out to parents at an early stage, whenever maybe their pregnancy is just starting off in that antenatal stage, has a bigger impact really for them and the baby. So we would be in Aware, we're part of what's called the Maternal Mental Health Alliance. And we really would get community groups together, statutory groups together, and we become the voice for um, that parent really in those early stages and campaign for services so to look after their mental health and help keep the cortisol levels down. So we're also part of the infant mental health framework for Northern Ireland as well. And if you're looking at infant mental health, it shows that there's a strong correlation between maternal mental health, so the mum's well-being, and the infant's well-being, and especially really within that early stages like brain development and up to the first 1,000 days of life. So our passion would be that the earlier we can reach people and support parents through that whole transitional period, then the better it is for both the parent and the infant.
Thank
I think,
you.
yeah, I was going to say, I think often, parents don't know what services are there. So we're often very aware of the physical impact of pregnancy or the changes that happen at home after birth, but we're not always aware of what services are out there for mental health. So there's lots of support in the community and voluntary sector as well as through the hospitals and clinics. And sometimes it's just a case of finding out where do I go? Where do I go and who can I talk to? So we know it's good to talk and me and you would talk about that, but it's really good to talk, but a parent or a new parent doesn't always know who they can actually turn to. So it's important really that they know both who to talk to and talk to the right people.
That's so true,
Yeah.
Marina. Definitely. And so further on to that, then you're talking about different organisational support within Aware NI. What does your organisation offer? How can you
So
support women?
Yeah, so we would run particularly we would have support groups, and then we have education and training programs. So part of my role would be more with regards to the education and training program. So creating a knowledge um, for people. So we offer two programs, and particularly in the Southern Trust area, we work with yourselves and through the maternity unit there to provide what's called Mood Matters. So Mood Matters is a mental health awareness program, and it runs for 2 hours. And really, what it covers is, what is mental health? What kinds of things might affect your mental health, especially during pregnancy or after the birth? And then it looks a wee bit further into stress, depression, anxiety, the signs and symptoms that you might be experiencing at that transitional period again, and then how you can either help yourself or reach out to community and voluntary sectors, or reach out to the statutory services or those professionals if you need that wee bit of extra support. So there's a bit of signposting in there. And then after that 2 hour program, if someone identifies that, actually I have been feeling a wee bit off, or I've been struggling a bit, or it's been lasting for longer than I really thought it should, then they can attend what's called our Living Life to Full program. So that's a 6-week program, and it's a CBT based program. So, CBT is what we would call cognitive behavioral therapy. So, cognitive is how we think, and behavior is what we do. And then the therapy part of it is that by maybe looking a little bit deeper as to how we're thinking or behaving, if we make a small change, then that can affect really our physical bodies, and then it can affect actually how we're feeling overall. So, sometimes making a very small change can make a massive difference. So, the 6-week programs, you can register online. You can register onto any of our programs online on our website, www.aware-ni.org. It's self-referral, or you can speak to your midwife or your GP. But there's access there straight away, really, to sign up to one of the programs. If there isn't one in your area, there's a little space on the website just to put your details in, and somebody will contact you then with other options. So I think those are the two main programs that we offer for perinatal. We also link, as you've rightly said there, with other organisations who can support people through pregnancy. So we have. We have a lovely little booklet. So we have a booklet called A Guide to Looking After You and the Mental Health of You and Your Baby. And inside that little booklet, and that's available online and in hard copy, but inside the booklet, there's lots of little tips on how to look after yourself, and kind of what's gives you a bit of an understanding of what's normal during that transition, how your mood can be impacted, and uses a few of the wee CBT techniques as well to try and challenge our thinking, or maybe try and think about things maybe in a different way. And then if it's something to do with, behavior, or the need to reach out or ask for help, then there are lots of signposts and organizations in the back of the book, either online through websites, or here in Northern Ireland, that you can just lift the phone and give them a wee ring.
That is fabulous. And we can link that to our website as well, which
Absolutely.
if you need to get that, if anyone's listening in the audience. So thank you, Marina. So what advice would you give to somebody in the audience who's really struggling right now with their mental health? What advice would you give to them?
I would probably say, Gemma, just try and think of your mental well-being the same way as you would your physical well-being. Think about if you were struggling with a physical condition during your pregnancy, what steps would you take? We wouldn't think twice about getting our physical body checked out, and you would tell people around you what's happening, or that you weren't maybe as fit as you usually are to carry out tasks, and maybe you would chat through those difficulties or limitations with them. So I think if you're doing that, usually that would either give you some reassurance, or maybe a direction or signpost on who to contact. So it's exactly the same with your mental health, and it's equally, if not more so important, that you do the same. I think, especially for a mom, keeping your stress hormone levels down during your pregnancy is very beneficial to both you and your baby. And it's quite normal that you would have those anxious or stress feelings, but you may need some extra support, and that's okay. I think also, Gemma, it's good to say, you're not the only one to felt like this. And feelings of anxiety or stress or low mood can be very, very common. And mental illness also affects 1 in 10 during pregnancy or after birth. So it can be a scary place to maybe feel unwell, and you're already worried about your baby and stuff like that. And you don't really understand why you're feeling like this. But I would say to anybody struggling, please know that you're definitely not alone, even though it might feel like you're alone right now. It is a challenging time, and it's understandable that your thoughts and feelings and behaviors would be impacted. Your physical body's changing, your life's changing, there's the unknown is approaching. And so it is really normal to start to feel a little bit anxious. But there are times when maybe you just need that extra bit of support. So again, I would remind any parent to link in with those sources of support around you, even starting with family and friends, or if you've already spoken to family and friends and you think you need that wee bit of extra support, talk to your GP, talk to your midwife, talk to perinatal mental health team, or link out into your community, the likes of Sure Starts or Home Starts. And I think then as well, sorry, I'm talking on here, but I think, also like if somebody wanted to talk to peers or to talk to somebody who understands exactly what you're going through, it's good to talk to a peer because they're going to have a chat with you without judgment. They're going to know what it's felt like to have been there. Um, and it means that you can say those things that are in your mind or in your heart that you're maybe not able to say, or you think, gosh, well, somebody would judge me for saying that. But I think if you go to like the likes of a support group, you've got Support Together, which is specifically for people with perinatal mental health issues. We've got Aware here, which is we have 26 support groups all over Northern Ireland. There's parent rooms, which are over Northern Ireland as well, which are again specifically for perinatal. And there's Soul to Soul in Newry. So there's lots of organisations. The likes of Parent and NI would be another organisation who can offer advice and support. And again, as I mentioned, those details are in our wee booklet. So we can maybe put the link to the booklet onto the website there as well, Gemma, and people can access that straight away then.
Thank you, Marina. That has been really insightful. Lots of tips and lots of information, which is what we want, particularly in this week of Maternal Mental Health Awareness. I really appreciate your time. I know you're extremely busy, and it really means a lot for you to come on here and talk to our audience, especially on this week. So thank you for your time.
Thank you, Gemma. Sure, it's fabulous. And thank you for all the work you do down there as well.